Today we're going to briefly discuss posterior capsule opacity. And that's essentially when the back surface of your lens after cataract surgery becomes opacified. And that can lead to blurred vision, whether weeks, months to even years later. Fortunately, there's an easy solution for that, and we're going to just discuss that briefly now. But for those who weren't sure what actually happened to your eyes when you had cataract surgery, this is only relevant if you've had cataract surgery in the past, is that in the eye you had a lens. And this was your natural lens, and sometimes this lens became opaque, and so the lens looked more like this. And as a result, you had cataract surgery done where this lens was removed into the front part of the capsule. So this is the anterior or front capsule was removed. The lens was removed out your eye, and once that old lens was removed, a new lens was implanted that looked something like this, and that was injected into your eye. Now, the back surface of the lens, which is essentially this part of the lens, wasn't removed at the time of surgery. And the reason we don't remove that at the time of surgery is that in this part of the eye, in the posterior or back part of the eye, there is gel or vitreous. And if we remove this back capsule at the time of surgery, vitreous comes from the back of the eye to the front of the eye. And there are ways of dealing with that, but that's not normally a scenario we want to be in. Occasionally that happens, and it's considered a complication in surgery, and one needs to deal with that. But majority of the time, that posterior capsule is left intact. And that's normally clear. Over time, that posterior capsule can become opacified. And that's what we call a posterior capsule opacity. If that happens, we need to remove that opacity, and we do that with a laser. Here is a typical image of a posterior capsule opacity. You can see the edge of the pupil there. This is where the edge of the IOL. The IOL is the intraocular lens that was implanted. And this material you see on the back of the lens we call posterior capsule opacity. It can look a variety of ways. This is just one example. Here's another example here. You can see there's almost like this bubble appearance and wrinkles in this capsule. And the vision through this looks like you're looking through a dirty window, and so obviously the quality of the vision deteriorates. And so this is an example of someone who's had a laser procedure. The laser has removed the posterior capsule, which is safe to do with the lens in place because the lens provides a barrier between the gel, which is at the back of the eye, coming forward. So at this stage it's very safe to perform this procedure. This is just a basic schematic of what it looks like. Here you can see this is just an animation of the back surface of the lens, and we use a laser to remove the back surface there. And this we call a YAG laser. So if you've ever heard someone say they've had a YAG, or their eye's been yagged, or they've had a YAG laser, normally that means that they've had cataract surgery, and after cataract surgery they've developed this opacity on the back of the lens, and so they've required a laser to remove it. This procedure is an in-rooms procedure. It's not something that is painful. You do need to have your eye dilated because that allows us to view the lens and the posterior capsule more clearly. It's done as an in-room procedure, as I said. It's at a machine that you're probably very familiar with. It looks exactly like a slit lamp. So a place to put your chin in a rest, your forehead against another rest. And then normally all you hear is some clicking noises. As the button is pressed, there's a small click. It's not painful. Occasionally patients can feel a sensation, some movement, but it's definitely not uncomfortable. And essentially that laser cuts or removes that back capsule. After the procedure, you may have a few floaters. The reason for this is that material in the posterior capsule floats around in the vitreous. Normally that settles down after a short period. The vision may still be blurry on that day because your pupil is normally widely dilated, and with that you get blurred vision, light sensitivity, etc. And then your doctor will give you some advice on when to follow up. It's important that if you develop any symptoms after a YAG laser to report it to your doctor, particularly any symptoms of new flashes, new floaters, a curtain developing decreased vision or anything like that, to return immediately. But normally it's a safe, relatively routine procedure that is performed very, very often. But that's something to be aware of even before going into cataract surgery, so that if a few months after your surgery you find the vision that was very clear becomes a little bit blurred, you may have a posterior capsule opacity. But fortunately, nowadays it's a very routine, relatively easy thing to address. Thanks again for listening. Really hope that was helpful. And if you have had cataract surgery and you are experiencing decreased vision or blurred vision, let us know, and potentially we can help.